The answer is estrogen causes cancer.
Right. So that was kind of the big headlines that were grabbing, everyone's attention was estrogen causes breast cancer. And that was not at all what they found. Women, so there was two groups in the study. One were the estrogen only group versus placebo, and then the estrogen plus progestogen group, which was Premarin and Prempro, the two meds, which were the most commonly used HRT options at the time. So it's not unusual they would have chosen that. We don't really use those today. So just heads up.
Yeah.
We have better formulations now, but this was, 1992 when they started recruiting. So women who had a uterus, you need progesterone if you're taking estrogen to protect the lining of the uterus. And then women without a uterus, they just gave them Premarin. And in the estrogen only arm, there was no increase. There was 30% decreased risk of breast cancer. In the estrogen plus progestogen arm, what they found in that population was a very slight increased risk of breast cancer. It went from about 4 out of 1,000 women per year to about 5 out of 1,000 women per year, which is a 25% relative risk increase. Now, statistics are hard. They're hard for me, but relative risk is looking at population. So that's not what's being told to women. They're saying estrogen causes breast cancer. It wasn't the estrogen. It was probably the progestogen that they used, because the estrogen only arm saw a decreased risk. So they used Provera, which was a common formulation used for a progestogen at the time. And that is now felt to be more closely related to maybe a slight increased risk. Again, the absolute risk. So if I sit down and talk to a patient, your absolute risk versus placebo is probably around 1% higher per year if you take this specific combined Premarin, Prempro. We have so much European data, a Danish study, the Finnish study, we have French data, all looking at different formulations, different things. First of all, if you believe that data, it's the progestogen, it's not the estrogen. So estrogen levels are never higher for females than they are when they're pregnant. And we don't get breast cancer in general, when we're pregnant. And so if your breast cancer cell, which started as a healthy cell and then had a malignant transformation due to whatever, environment, genetics, whatever, cheese holes lined up for you for this to happen, and you retain that estrogen receptor, they can use that receptor to fight your cancer. It will choke off. We need estrogen for the cell to keep living. And so, women who were in the WHI, who were diagnosed with breast cancer, had a lower stage than the placebo group, and they had a higher survival rate. So that's the conversation I'm having with my patients. Now, a family history of breast cancer outside of a BRCA1 or 2 genetic malformation, but just your mom, your aunt, your grandmother, and there's no genetic anything, there's no increased risk by being on HRT. There never, multiple studies, no one has ever shown that. It is perfectly safe for you to be on it. What's not happening in the conversation is, what happens if I don't choose HRT? What am I more likely to be at risk for? Alcohol is just as big or a bigger risk factor than MHT for breast cancer. No one's having that conversation with their patients. Obesity, another tremendous risk factor for breast cancer, way more than menopause hormone therapy. So, when I'm presenting all of this data to patients and having informed conversations, these are the things I'm talking about.